Hi, I'm Dr. Mohammed Suhail Panawala, and welcome to the series of lectures on leadership. It gives me great pleasure to welcome you to this lecture series on leadership. And as we know, it's not about authority or position. Leadership is a discipline that integrates knowledge, skills, and values to influence and guide others towards shared objectives. In today's rapidly evolving professional environment, effective leadership is recognized as both a science grounded in established values and theories and evidence based, and it is an art requiring adaptability, ethical judgment, and strong interpersonal skills. Over the course of these sessions, we will systematically explore the foundations of leadership, its levels, and its diverse styles. We will also examine the essential competencies that distinguishes effective leaders, including critical thinking and communication, decision making, emotional intelligence. In addition to these traits, we will also explore some of the contextual dimensions of leadership, particularly how leaders can foster growth, resilience, and sustainable organizational development. It is my hope that in this series, we will not only enhance our conceptual understanding of leadership, but also provide practical insights that can be applied within our respective professional and organizational boundaries. So, let us begin our journey into the study of leadership. John C. Maxwell, who is the guru of the leadership, and he has written many books on the traits of leadership and many examples of leadership he has explored in many professions, not only in the healthcare, also in the industrial and also in the telecommunication. According to him, leadership is not about titles, positions, or flowcharts. It is about one life influencing to another life. Introduction of the leadership is not a simple thing to be done in few minutes. It is an act which can be demonstrated by the leaders throughout the world to emphasize the importance of leadership. Leadership is not defined by title or name badge, but by the impact a leader creates. Yet, every leadership journey begins somewhere, and that somewhere is first positional leadership. Now, we'll explore in healthcare what are the positional leadership and what are impacts on the people around the subordinates or around you. So, in healthcare, there are hierarchies and roles are clearly defined, and the level one leadership is often the first step for doctors, nurses, and administrators stepping into this supervisory roles. So, at this level, people follow you because they have to, they don't have any option, not because they want to, they have to. Authority comes from your position, consultant, charge nurse, department head, rather than from trust or influence. It is a doorway to leadership, but it should never be the destination. It is not an static position. So, what are their characteristics? This is the authority position, which is the title, not the personal influence. Followers of the leader, of that leader, which has the position, comply with the rules and orders out of obligation. And the positional leaders can get short term results, but struggle to inspire the commitment if they don't move into other levels of the leadership. So we can give some examples, like consider a newly appointed or head nurse in an operating theater or ER. The staff obey her instructions, not because they admire her leadership, yet because she holds an authoritative position. If she says we will change the way instruments are counted, the team follows. It complies with this. But if she fails to explain why or neglects to support the team, then compliance may fade into resentment, into irritation around the environment. So, positions give authority, but only influence earns respect. This is the take home message. So, if the person is in the positional status, level 1 leadership, and he is staying for quite a long time without moving into the level 2 or level 3 or 4, it is a risk. Remaining a positional leader can create frustration and distrust in healthcare settings. For example, a consultant surgeon who gives orders without explanation may see junior doctors cannot comply, but they disengage emotionally. And a hospital administrator who relies only on rules, which they can enforce, and the people comply, but never earns the staff's loyalty, making quality improvement projects harder to sustain. So, how to grow beyond the level 1 leadership? This is the main question. While level 1 is the main entry point, true leaderships require growth. Healthcare professionals can build relationships, and it takes time to know your team beyond your job descriptions, to interact with them, to know their grievances, to know their issues. They can model themselves as a professional person and demonstrate integrity, punctuality, empathy in daily life practices while working. They communicate their vision, what they want in their leadership tenure. Instead of just giving orders, explain why a protocol matters, why it is necessary to follow the policy, why it is necessary to follow any clinical pathway or guidelines. Invest in the people, support continuous education for them, do mentorship for them, give them the feedback. For example, I give you an example. A Dr. A, any example, a Dr. A, he's a young ER consultant, initially relied heavily on his authority. This is an example, okay? His team followed his orders, but they lack enthusiasm. Over time, he began involving the nurses and their subordinates, residents in decision making and mentoring them, acknowledging their input and their work in trauma resuscitation and other management of the patient. Slowly, he noticed a shift in the behavior of his team. They don't only follow their rules and regulations and protocols, they respect him or her, often anticipating his needs during the emergencies. So, what began as a positional leadership evolved into influential leadership, and the entire department morale is improved. So, to conclude this session, we should say the positional leadership is the first step or entry point into the leadership domain or a ladder. We have to progress, we have to grow, a leader has to grow, and it is unavoidable. Roles, titles, and authorities matter, but the greater leaders don't stop at level 1. They recognize it as a starting line, not a finish, not a destination, not as the end point. By moving beyond the position into the leadership, relationship, trust, and influence, healthcare, healthcare providers around them and their subordinates, they inspire the teams that deliver safer, more compassionate, and more effective care. So, this is all for this talk right now. We will explore other levels of leadership in other video, inshallah.